Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Let's take a look at angles in general, which ones are used. These angles, the tibio-talar, calcaneal pitch, tibio-calcaneal, talocalcaneal, the naviculo-cuboid, talonavicular coverage angle, the lateral talar first metatarsal angle, the metatarsal stacking angle, AP talo first metatarsal angle, and the medial lateral column ratios are sometimes used to denote how we can talk about the alignment of the foot. Looking at the tibio-talar angle, essentially what we're measuring is a bisection of the tibia relative to the floor, and we're going to see whether or not the tibio-talar angle is either positive or negative, denoting varus or valgus alignment. Looking at the tibio-talar angle seen here, we can appreciate the valgus situation, that the talar vector is pointing towards the fibula in a situation of valgus deformity. And in this case, the talus is pointing towards the medial malleolus in a varus deformity. In looking at the calcaneal pitch angle, this is a very important angle for us to understand. We use this regularly in determining whether the patient is flat foot or has a pes cavus situation. And what we're going to be looking at is to draw a line from the plantar calcaneus to the calcaneal side of the calcaneocuboid, and also a line from the plantar aspect of the calcaneus to the base of the fifth metatarsal. This C line actually should go up towards the fifth metatarsal. And what we're looking at in these situations, correctly labeled here, is that in the situation of pes planus, notice that the calcaneal pitch angle is decreased. That calcaneocuboid line is in closer proximity to the line between the calcaneus and the base of fifth. And we can see in pes cavus the opposite occurs, where the calcaneal pitch line elevates with respect to this calcaneocuboid line relative to the plantar line at the calcaneal base of fifth metatarsal. Pes cavus, pes planus, calcaneal pitch angle, very important in this area. Looking at the tibio-calcaneal angle, how we're going to measure that, this is going to be a bisection of the tibia, and then we're going to look at the vector of the calcaneus. And this can be important to help us discover some patients who have clubfoot or a Echinus deformity. So what we see here in the normal situation is that the calcaneal inclination points up at the dorsal aspect, and that's your calcaneal attitude. When the calcaneus points plantarly, that's an echinus attitude. And what we see in clubfoot is that they often have an echinus or neutral position. The tibio-calcaneal angle can be used to identify patients who have echinus. Seen here on this x-ray at the lower right, we see that the tibia relative to the attitude of the echinus position calcaneus is widened. Notice in this case, what we see is that the talus relative to the neutral axis is actually narrowing in this patient, who also has abnormalities and rocker bottom deformity in this patient. Looking at the talocalcaneal angle, this is a very important angle where we're looking to identify valgus deformity in the situation of, say, a pes planus, but we're going to bisect the talus by taking that bisection line between C and D and A and B, drawing a line, and of course the plantar aspect of the calcaneus. And attitudes greater than 45, angles greater than 45, will denote that there's an elevated talocalcaneal angle, and we can see that here. When we're measuring these angles, again, if we see that the talus and the calcaneus vector is widening, this is a situation seen in hindfoot valgus or pes planus. In this case, we can see that the vector between the calcaneus and the talus is actually slightly more narrow, and that's a situation that's seen in pes cavus. And we don't usually get a great angular measurement on the lateral projection for pes cavus because the talus actually rotates. And when the talus rotates, it can give us an artifactual number. So that's the reason why on a lateral projection, it's not as often used for pes cavus, this lateral talocalcaneal angle. The naviculo-cuboid overlap I use quite often, and that helps me to see how pronated or supinated the hindfoot and midfoot sectors are. And what I'm looking for is to look at the dorsal aspect of the cuboid and relate that to the lowest point of the navicular. In patients who have the cuboid navicular coverage of greater than 50% seen here, we can see that in patients who have pes planus, there's a greater degree of coverage, as opposed to the opposite situation where we see that there's undercoverage. The navicula doesn't really cover the cuboid. That's a situation we see it in pes cavus. Looking at the talonavicular coverage angle can really help us when we're determining pes planus. It's a highly correlated angle. And what we'll be looking is to try to understand where the navicular articular endpoints are at C and D and where the talar articular endpoints are at A and B. And we're going to then take a midpoint of these lines and understand the angle between them is your talonavicular coverage angle. In patients who have a situation that, say, pes planus, notice that the talar vector, we have this degree of undercoverage, so it's becoming undercovered. And in the opposite, notice that in this patient, the talus is actually moving lateral respective to the navicula in a patient who has pes cavus, and this is a negative talonavicular coverage angle. Looking at the lateral talo-first metatarsal angle, one of the most important angles called Meary's line. And what we're looking for is that the talus and the first metatarsal axis are aligned. And when we draw these lines, we're looking to bisect the bisection of the talus as denoted by C, where we're going to take a midpoint between the talus, the neck, and the head, and compare that to the mid-metatarsal line. And what we can see in these cases is that when the talus and the first metatarsal axis are declinating, that's a situation where we have pes planus, as opposed to this situation here, where notice the talus vector versus the first metatarsal vector are elevated in a situation of pes cavus. The metatarsal stacking angle can be used to determine whether or not we have a situation where the angle between the first and the fifth are actually narrowed, and that would be in a situation when you have pes planus. The metatarsal stacking angle shown here, we can see that if we draw a line along the fifth and a line along the base of the first, we can see the difference of the metatarsal stacking angle here in a patient who has pes cavus, very well seen, and in pes planus, barely any line seen at all. Looking at your AP talo-first metatarsal angle, we can appreciate that the vector between the talus and the first metatarsal on an AP projection. Using that to help us look at alignment, we can see in that AP first metatarsal angle here, when we compare this, what we see is a widening of that AP talo-first metatarsal axis as the talar head uncovers a situation of pes planus. Now, if we drew that vector here, the talo first metatarsal angle, it would actually be more narrow in a situation of pes cavus. Looking at the medial to lateral column ratios are comparing where the first metatarsal is relative to the talus compared to the base of the fifth metatarsal and the fifth metatarsal axis altogether, and the line bisecting the calcaneus, and measuring the column. When we can see the columns different from one another, we're looking inside the foot and looking at the medial column, which is the hallux, higher than the lateral column. Notice what happens in the disease state. In a state of pes planus, where the talus is moving towards the ground, these angular ratios are actually decreased, as opposed to here where they're actually increasing. Looking at the hindfoot alignment view and being able to say whether there's varus or valgus are denoted by these angles where we have the tibia and the calcaneus. And what we're noticing is that as we bisect the tibia, this calcaneus is moving slightly towards the fibula in the normal position. In looking at the application for the long axial view, in looking at the bisection of the tibia and relative to the calcaneal vector, we can see that as we move towards the medial axis, this is a situation of varus angulation. And in fact, looking at this patient here where we see the tibia relative to the calcaneal floor angle, notice it's slightly valgus. And in this case, we can see it's even a greater degree of valgus. So even within the same patient, we are able to measure that difference in a weight-bearing X-ray. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.